A particularly critical cause of infection transmission in hospitals is the formation of biofilms in siphons, located at the sink in patient rooms. When water enters the siphon, splash water and subsequent formed aerosols can release pathogens into the room and transmit them to patients and nursing staff. Even if the siphon is cleaned regularly and intensively, it is impossible to prevent the formation of biofilms in the siphon. Our aim is to prevent the formation of these biofilms and thus the transmission of pathogens with the UV-activated surface funcionalization. It is used as a microbiological barrier in the siphon. In a first step, a suitable base substrate had to be found to apply the coating, and suitable coating parameters had to be evaluated. In the next step, appropriate UV sources had to be found for the stable surface activation, and the resulting germicidal effect had to be evaluated. By UV radiation, two photo-induced effects can be triggered on the used coatings: photocatalytic decomposition and photo-induced hydrophilicity. Our microbiological barrier uses the principle of photo-induced hydrophilicity. This means that the water spread over an activated coating like a protective film, which prevents the adhesion and accumulation of germs. Here we have a prototype of our siphon, and this is a coated piece of sewage pipe. This is where the coated pipe is attached, and for activation UV LEDs are used. These LEDs are positioned directly opposite the coating. At this point, the spread of biofilm from the sewer is stopped, hence biofilm formation in the siphon is prevented. The coronavirus is currently one of the most critical pathogens in hospitals. Since the germicidal effect of our coating is independent of the type of germ, our coating can also be used against the coronavirus. The layer thickness of the coating was approximately 3 micrometer. The coating was activated with a 365 nanometer LED, and in our experiments using colibacteria, after 30 minutes activation, the coating shows a germ reduction up to 99%. Due to the hydrophilicity and the resulting spread of water on the surface, germs can be prevented from accumulating regardless of their type. Therefore, different UV doses are not necessary to reduce different germs. The effectiveness of the coating can be increased by doping, so that an even more efficient germ reduction is possible.